Welcome to We Are Hospitality, a podcast from the Rhode Island Hospitality Association, with your host, me, Bill Bartholomew. So welcome into another edition of We Are Hospitality, the Rhode Island Hospitality Association's weekly podcast and videocast series. I'm Bill Bartholomew, and today we have Cathy Feeney of the Office of Food Protection. So this is something that COVID, no COVID is pretty significant, I would say, in terms of a sustainable hospitality industry.
Exactly.
Well, let's get right into it. You're the chief of the Center for Food Protection within the Rhode Island Department of Health. Sounds like a big job. Can you kind of explain it to all of us?
Yeah, so my department does have a big responsibility. Unlike other states, we only have one Department of Health and one Center for Food Protection, and we're really responsible for all the food in the state. So we license and inspect restaurants, obviously, but also markets, food trucks. We do healthcare facility food services. We do school food services. We do the special events, the temporary events where they have food like, Washington County Fair and Newport Jazz Festival and those type of things.
Mm-hmm.
And we also do dairy. So we do the dairy farms and we check pasteurization, and we do the shellfish and make sure that, shellfish is received from approved sources, waters that are, safe for, harvesting shellfish. And we also do manufactured food, which is food processes that make anything from like a tomato sauce to even a bakery, or somebody who wants to make a barbecue sauce or a relish, cookies, all kinds of things. So we do it all. And we have about 7,200 licensees doing
Wow.
a variety of different things.
In what ways has COVID-19 impacted the hospitality industry in Rhode Island, and how has your job role changed over the past year?
Yeah, so it was last March, it was like the rug got pulled out from under all of us. And It was just so devastating when all the restaurants were closed and there was a lockdown. And, my staff were looking at me like, what do we do now? It was just horrible. And so, one of the things that we had to do right away was, get in touch with people, give them guidance. If they had cases, we worked with industry, a lot. Like a restaurant would call and say, one of my cooks just said he was positive for COVID. What should I do? We're shut down anyway. We're just open for takeout, that kind of thing. So we started working with the industry right away, doing things like helping them with their COVID compliance. Making sure that they knew when to quarantine and when somebody should be isolated from the facility. And, just trying to figure out what the landscape was, like who was doing takeout, who was closed completely, that kind of stuff. So we started doing that. And then really quickly, we started getting activated. So most of my inspectors ended up as part of the COVID team. So we all worked in different groups. One of the groups was actually dedicated to disease investigation and contact tracing of restaurants and other industries. So we had a whole team just doing that. And we all were working in different jobs. Even myself, I was in charge of all the group homes. So if there were cases in any of the group homes, and we have 400 group homes with DCYF and behavioral health, and, talking to those people, if they had cases, how to get tested, all those kinds of things. So we were really busy doing other stuff, but we started doing helping the industry by making phone calls. A lot of people had questions about what they could and couldn't do. So, and we provided a lot of guidance documents. We sent out a lot of emails with different, guidance on how to do take out safely, or a lot of people wanted to start processing something so that they could increase their business. And, we'd help them with that kind of stuff too.
What are some of the adjustments or adaptations that have been made because of COVID that will change the future work of the Department of Health?
Well, it was funny because I think that it's we really learned to use technology in a different way. We had never done virtual inspections. That was just something we didn't do. And we didn't even do appointments before, really. it was always an unannounced inspection, except for an opening, we would call ahead and make an appointment. But we started doing a lot of stuff virtually, and it was working out really well. So especially for like something like an opening, if somebody wants to open, there isn't a lot of stuff there to even watch because nobody's actually preparing food. So we would be able to do that virtually. So we started using all kinds of different ways of doing that. And then we were having more of our meetings virtually. In training, we were doing a lot of training, all virtual. We're much more conscientious about physical distancing and hand washing. But I have to say it was interesting because the food industry is one industry where they used to washing their hands. It wasn't anything new to them.
Sure.
They were like right on it. It was like amazing, because they always did it. That's the way they operate. The biggest problem in the kitchens is the physical distancing because, kitchens are small. So, our inspectors were very aware of that, and they didn't want to be another person in a crowded kitchen. So, we worked around it. Usually we go when they're busy or when at least they're doing something, but we were going at times when they weren't busy. And we were telling them we were coming, and it was working out fine. So I think that, and also that we became very much a partner with the industry and very empathetic to what was going on. It was, we were really upset as the industry was, and we could feel their pain, so to speak, because, they're losing money. It was just horrible, just very, very difficult for people. And we certainly understood that and tried to work with them and help them as much as we could without, having them do something that they could wait to do. Like if it was something that was going to cost them money, we'd put it off. Just leave status quo for now. You don't need your new floor right now, even though your floor needs to be replaced at some point. Wait till you get back on your feet, that kind of stuff.
What recommendations do you have for businesses, especially in the food service industry, and what tools are provided to businesses in Rhode Island to help them operate safely?
So what we did was, because we had a lot of time when people had more of a chance to work on projects, we actually ended up doing a lot of guidance documents, geared for industry, and we actually had them translated into 6 languages. So we have like Haitian, Khmer, Portuguese, Spanish, Chinese, and I think it's, been written, it just helps the industry because there's a lot of people who speak different languages working in restaurants. So having these kind of guidance documents in multiple languages is really helpful when we go out and, we give them to the owners or the managers, and they're able to communicate better with their staff or even make posters and put them up. So that was one of the things that we did to help them operate. We're also like really encouraging them to come to us if they need guidance. A lot of times they'll go through a third party, which is fine because they need the assistance and they want to have somebody there, but never feel like you can't call the Department of Health. We're always there. We'll answer your questions. We'll walk you through it. And the earlier you call, the better, because then you haven't done something that you have to undo. So like if you're building a restaurant, and doing construction, we always tell them, come in with your blueprints. We don't want anybody to have to like move a sink after the fact, so come in, we'll talk you through it. We'll work with you, or not even come in anymore. It's more like we'll do it virtually. We'll set up a Teams. We use Teams a lot. Or a Zoom meeting with industry and help them through that way. Sometimes we go out in the field and we work with them then.
Just developing partnerships. Basically.
Yeah, really. I mean, we always did, but I think right now we're really like trying to help them more than ever because we want them to succeed. It's really, really important to us that the restaurant industry does well. Nothing hurts us more than when you see somebody open and then they don't make it. It's very upsetting to everybody. We're rooting for them, from the time we open them, all throughout their whole business.
What about your relationship with the Rhode Island Hospitality Association? What's that been like? What changed in COVID, if anything, and what's that partnership like?
I think it was like, became even stronger. It's always been strong. I have to say we work together very, very well. We want the same things. We want to keep the standards high for the industry. That's what Rhode Island Hospitality Association wants. They want to educate members. We want to educate members. We don't want anybody to get sick. They don't. we want it to be a thriving industry, and that's what they're all about as well. So we always work together well, but I think it's almost like we became more partners in helping industry get out of this, and really like doing everything we can to, get through this pandemic, kind of like, working together, making sure that we're protecting the industry. There's people who want to start a restaurant, not a restaurant, but they want to sell food on the side of the road and things like that. And, we want people to have it to be a level playing field so that, everybody has to follow the same rules, and we keep our standards high, and we make sure nobody gets sick, because that would be a disaster for tourism and everything else. It's, if somebody gets sick on shellfish, it's bad for the whole industry.
Yeah.
So, we work very closely with Hospitality Association to prevent that kind of thing from happening.
Cathy Feeney, she's with the Office of Food Protection over at the Rhode Island Department of Health, who have been thrusted into the spotlight over the last year and change. Thanks so much for your time.
Thank you very much.
Thanks for listening to this episode of We Are Hospitality from the Rhode Island Hospitality Association. For more information, visit rihospitality.org or search RI Hospitality on your preferred social media platform.